Hello everyone, this is my last video and I'm really sad to see class over. I'm sure you guys are probably happy to be finished with class, and I'm really impressed. This has been a really weird semester. This is my first time teaching online. I'm sure it's many of your first times taking an online class, and you should be really proud of yourself if you've been able to get through this class and get through your other classes online and get through this time frame. Hopefully soon we will be able to get back to life as normal. But in this video, I'm going to talk about psychological disorders and the history of treatment of psychological disorders. I'm not going to talk about all the different therapy techniques and counseling theories. We've talked about many of them throughout the book, and really most of them are not theories that are used today. Cognitive behavioral therapy is one of the major therapies that is definitely modern and current and what we're using today. And there are always new therapeutic techniques being developed as well. So, but many of the older theories, all counselors and psychologists will learn all these old theories and may incorporate some of those theories into their counseling. But in general, that's not something that I think you guys need to know. But I'm going to talk a little bit about the treatment of psychological disorders. I'm going to talk about insane asylums and psychiatric hospitals and facilities. But first, I want to start way back in the beginning of time. Well, we know that there is historical documentation of mental illness throughout time, mostly symptoms of schizophrenia. And people who were mentally ill back in the day were often mistreated, killed. Really, people were afraid of people with mental illness and really didn't understand what was going on. They often thought they might be possessed by the devil. So many priests and religious people would perform exorcisms to try to rid the person of the evil spirits. Don't know that it was necessarily successful, but at least it was a humane treatment and they really were trying to help the person. This image here is an old image, and they gave a range. It's circa 1488. And this is an image of somebody giving a treatment that they call trephining. And what they did, and it's kind of a lobotomy, um, an archaic sort of lobotomy, although I guess there aren't any good lobotomies. They would cut a hole into the person's skull, and sometimes they'd take a part of the brain out, and in the hopes that maybe that would solve their problem and also let the evil spirits out as well. So really mentally, people that had mental illness were really mistreated. And oftentimes when they had this trephining treatment, they may not survive and certainly might have some severe deficits because of it. So a lot of times they were put in jail, they were chained, they were really considered possessed and evil, and so people were fearful of them. In the late 1700s, Philip Pinel in France advocated for moral treatment of people with mental illness, and he created the first mental hospital in 1793. Now, this is a famous picture of him releasing women from their chains at the Paris Asylum for Insane Women. That was actually the name of it, which is really sad, hard to imagine. But he really felt like women and any person that was being treated for mental illness should be treated with respect and care and kindness. And here's some really weird primitive restraints that they would put people in, really kind of bizarre stuff, but they really didn't know what to do and they were fearful. And so that's what they did. So Dorothea Dix was a person in America in the late 1800s, and she created the first asylums here in the US to help improve treatment for the mentally ill. And she really advocated for the humane treatment of the mentally ill. And the first mental hospitals were really nice places. They were places where people, you could find comfort, where they could have housing and food and be taken care of. We didn't have treatments, but they were just trying to help them as best that they could. And then in the 1930s and the 1950s, these hospitals got very overcrowded, staff got overwhelmed, they became very dirty and often abusive to patients. There are several shows on TV where they're looking at abandoned asylums and looking at looking for ghosts and things like that because they felt like there were some severe abuses that went on in these different insane asylums, and that's probably true. That was never the intent with the psychiatric hospitals, but definitely things got out of control and staff got really overwhelmed. And many patients probably could have been safely treated at home, but family members said this person's crazy, or, after Thanksgiving, we might all think, I'd like to check in a few of my relatives. And there was no laws against that. So people would just get checked in and committed to a mental institution against their will. And sometimes for things like obesity and depression, things that we would never admit somebody for in an inpatient psychiatric facility today. And patients were often institutionalized for decades. And there really were very limited treatment options at this time as well. They did perform lobotomies and often caused severe brain damage. This picture, which you can't see here, I'll just do it this way, is of Rosemary Kennedy. And she had a lobotomy in the 1940s. There's speculation that she was schizophrenic, but there's no documentation that I have of what her diagnosis was. But she did have a documented lobotomy, and basically she was incapacitated and in a wheelchair for the rest of her life. And that was one of the few treatments they had, and there was hope maybe that it would help her, but unfortunately it did not help her. There was also electroconvulsive therapy, which I don't know if we'd call that therapy, but it's where they put electrodes on either side of the person's skull or their brain and send an electrical current through it. And the hope was that it would create a seizure, which it always did. It would create a seizure in the person, which would release a bunch of endorphins and help with the person's symptoms. Had limited results, and unfortunately in the 30s and 40s and 50s, when they were performing these ECT treatments, they didn't have great control over that electrical current, and many people suffered really severe brain damage from ECT treatments. It's actually still used today under anesthesia and definitely much more mild electric current, but it's still a really controversial treatment that I probably wouldn't sign up for myself. But they really had very limited treatment options. So they had lobotomies, they had ECTs, which often caused really severe brain damage. They do have padded rooms, restraints. This is a straitjacket. Padded rooms are definitely used today, and straitjackets may definitely still be used, and also restraints. Sometimes when people are in a psychiatric crisis, they will try to harm themselves, and you have to restrain them to prevent them from doing that. They might bite themselves. They might throw themselves against a wall. And so that's the reason why we have those things, not to be cruel, but to protect the person from themselves. And this is a really weird picture here, but this is one of their so-called treatments back in the day in the 30s. They would put people in cold baths. Now, if this was hot, I can see it maybe being a little therapeutic, but they were cold and they restrained the people in it. That's why you see all these little hooks here that they couldn't get out of them. So we had some pretty primitive treatments even through the 30s and the 50s, and pretty damaging. So in the 1950s is when we developed the first medications to treat psychological disorders, and were able to really help people with different psychological disorders. So in 1952, we created the first diagnostic and statistical manual of psychiatric disorders, I think. And this is really the first attempt to really classify and understand different psychological disorders, and then the medications were developed to treat those. So, and I put this movie on here because this is a really pivotal time in psychological history and an inpatient history. So if you've ever seen this movie, One Flew Over the Cuckoo's Nest, it stars Jack Nicholson when he was in his youth, and it was released in 1975. And the story was that Jack Nicholson was like a small-time criminal, and he thought he would be better off in a mental institution than he would be in jail. So he feigned mental illness and got sent to a psychiatric hospital. And it's a really interesting movie. and it shows a lot of abuses in psychiatric hospitals at this time. Nurse Ratched was one of the main characters and one of the nurses at the psychiatric hospital in this movie, and there's a new Netflix series called Nurse Ratched that's based on her character as well. So really in the 1950s and 60s is where we first started to really be able to help patients, but then we developed medications that some had some pretty bad side effects, and still a work in progress. Many people, especially after that movie, really felt like we shouldn't have mental institutions, and people shouldn't be forced into treatment involuntarily against their will. So there was a Rehabilitation and Mental Health Impairment Act of 1976, 1973, I guess right here. And it enacted laws to protect mentally ill people from being involuntarily committed. An involuntary commitment means that you are being treated against your will. And, all of the patients prior to that had lobotomies and ECT treatments actually were being treated against their will, and people were really up in arms about that. And I think rightfully so to a certain degree, especially because the treatments were so damaging. But our treatments today are not damaging at all. The medications are quite safe, have low side effects, and if a person has a bad reaction to the medications, we can take them off that medication and those. So it's not permanent damage like like we saw back in the 40s and the 50s. So today, if you want to have somebody committed to a psychiatric hospital, there is a petitioning process to get them court ordered to treatment. But it's difficult. You have to prove that the person's a danger to themselves or a danger to others. And oftentimes that's really difficult to prove. And the person might pull themselves together in order to prevent themselves from being treated, and they can refuse treatment. So once you're an adult, once you're 18 years old, you can refuse psychiatric treatment unless you get court ordered for treatment because someone has been able to prove that you're a danger to yourself or a danger to others. It doesn't happen often, but it does happen. Children, adolescents, if you're under 18, your parents or guardian can sign you in for basically involuntarily committed, but they can sign you into any psychiatric facility. But once you turn 18, you have the right to refuse treatment, which can be really problematic. Today, it kind of often prevents people that are mentally ill from getting treatment because often people are not in touch with reality enough to agree to treatment or understand that they even need treatment. And sometimes they're also very fearful of treatment as well. And our treatments are much, much better today than they ever were in the past. So there was a huge deinstitutionalization movement in the 1970s. And deinstitutionalization, I can't say it, it's a long word, really took patients out of psychiatric facilities and moved them into the community, hopefully with family, but many of them didn't have family. And unfortunately, they didn't really plan this out very well. They did develop community mental health centers that we still have today to provide treatment for people in the community rather than in an institution, but they didn't plan for housing, and they didn't plan for people with really severe mental illness. So unfortunately, it's led to a huge homeless population. There's estimates that 26% of the homeless population are mentally ill, and I think it's probably higher than that. But certainly, it's a large portion of the homeless population, and these are people who aren't able to care for themselves and or defend themselves. Often people who are mentally ill are beaten up, taken advantage of, stolen from, and really have nowhere to go. And it's really sad. Many people with severe mental illness are in the criminal justice system, and not for big time serial killings or anything like that, but just small time crimes because they're trying to survive and take care of themselves. They might be breaking into an abandoned house. They might be stealing something from the Circle K just to have something to eat. So it's really kind of a sad state of affairs. Your homework assignment has a video. It's a real short 5-minute video about how jails are becoming the new insane asylums, and they absolutely are. They're saying that 30% of women that are in jail have a severe mental illness, and that's not just a depression. Most people that go to prison probably have some depression and maybe a little anxiety, but they're talking severe mental illness, debilitating mental illness, and 15% of men have a debilitating mental illness. And then we also look at police shootings and fatal police encounters. About 25% of those, their person has a severe mental illness. And we don't talk about that a lot. There was a young black man that was shot and killed by police, and I can't remember. It was somewhere in the Midwest, and I don't remember his name. I should look that up. But he was definitely mentally ill, and he didn't respond to the officer's commands. He didn't really understand, and they weren't aware that he had mental illness because they obviously couldn't talk to them. And that happens a lot where there's a lot of misunderstanding, and police officers are trying to protect themselves as well as protect the community. And if you think about it, family members call police when they're scared and they know this person the best, and they call in police officers at the worst possible moment, and the police officer is supposed to be a mental health specialist and come in there and fix everything, and oftentimes their hands are tied. They can't be committed to a facility. Sometimes there's no facilities for that person to be there, and oftentimes it becomes a real merry-go-round where the police officers may take them to an emergency room. They are there for 24 hours and sent home, and then the police are called out again. So it's a really big problem in our society, and I don't think people recognize how debilitating mental illness can be for some people, and how not treating people with mental illness, not having facilities, not having long-term facilities for people with mental illness creates dangers for all of us, creates danger for police, and really leaves a lot of people who homeless and destitute that should be cared for. I think George Bush said at one time, our society will be measured by how we treat people who live at the mercy of others. And he was talking about the Terri Schiavo case at the time, which was a woman who was brain dead and had been kept alive for 10 years on a ventilator, and the husband wanted to turn off that ventilator. And but I think it's really true. There are people that live at our mercy because they can't take care of themselves. And how do we treat them? And how could we treat them differently? So 1 in 4 police encounters, fatal police encounters, 20% of jail and prison inmates, it's probably higher than that. And 1 in 10 of all law enforcement responses have to do with mental health issues. And I have a friend that's a firefighter, and you sign up to be a police officer, you sign up to be a firefighter, you think you're going to be fighting fires and fighting crime. And half the time, or much of the time, you're dealing with people with substance abuse problems and mental illness, and not necessarily well equipped to do that. This little infographic here is talking about mental health training for law enforcement, and I think that's really important, but we can't expect law enforcement officers to be mental health experts. And then we also need to provide them support and places to take people that need help other than jail. So something to think about. My little soapbox topic there. So I don't know if you guys know about the Arizona State Hospital. It's at 24th Street in Van Buren. It's a very old hospital. It's for the criminally insane. And what that means is that people have been committed because they've committed a violent crime, and that's why they're there, and they've been determined to be criminally insane. And then there are some people with really severe mental illness that are also housed there, but mostly it's for people that are criminally insane. And you can see the razor wire all around here. Occasionally there are prisoners that escape, but it hasn't happened for a long time. So it's a pretty it's a jail. I mean, they do provide treatment, but it's very jail-like. In 1973, when those danger to self, danger to others laws were passed, the census went from 2,000 patients to 300, and I would imagine today that it's around 300 to 500. I tried to look it up, but I couldn't find any info. But it's much smaller than it was um, uh, back in the day when people really were receiving treatment there, and it wasn't just for people that were criminally insane. We do have a lot of different psychiatric facilities in Phoenix. Well, I shouldn't say all, many of the Banner hospitals in town, Thunderbird, Samaritan, and actually, I don't know if it's called, it's Banner Thunderbird now, showing my age, does have a psychiatric wing. And if you have a friend or a family member or yourself are feeling like you're in a mental health crisis, you can go to the emergency room there. They actually have counselors there that will meet with you and evaluate your situation and see if you need to be admitted to the hospital, and if your insurance will cover it, all of those kinds of things. And then there's Aurora Behavioral Health, Valley Hospital. There's a lot of different facilities around town that are private facilities that people can be voluntarily admitted to. Now, if you were going to be involuntarily committed, Maricopa County Hospital is the one place in town that treats involuntary patients, and they do actually hold patients until they get a court hearing, which sometimes can take 3-4 days. Um, so they'll hold them and then treat them as long as they need to be. So insurance will pay for inpatient psychiatric treatment, but only when it meets their particular criteria. And their criteria is that you're a danger to yourself or others if you're released from the hospital. And so once the person's deemed to be safe and able to go back into the community, they're discharged. And it is expensive for inpatient treatment. It's about $1,000 a day for a person to be in a psychiatric hospital, which I don't know if that's how comparable that is to a medical facility, but it's pretty close. You'd see a psychiatrist there. There would be counseling and treatment, group treatment oftentimes there as well. Um, but our inpatient facilities that we do have really provide short-term treatment. The average stay is about 3 to 5 days. It's not long-term treatment. It's not housing. It's kind of a Band-Aid. So, and for people that have a good family and a good support system, that may be all that they need. But for people who are severely mentally ill and have very little resources, often that's definitely not enough for them. So on that sad note, I wanted to kind of make sure to leave you with a little bit of a positive note here. We have made huge advances in psychology and psychiatric treatment. Our medications aren't perfect, but they do offer relief to people that are suffering from psychological disorders and really can make many of the psychological disorders manageable and have people with psychological disorders lead really healthy, happy lives. There are lots of new medicines being created, new advances. They're combining different medications to improve people's well-being. And so there's still a lot of work to be done, but we really have made a lot of really good progress. Counseling is definitely effective in treating psychological disorders, and some people may only need counseling and not need medication. But medication can be really necessary in some cases, especially like if somebody's been really depressed for a very long time. If your brain chemistry and your serotonin level is so low that you have no energy, no motivation, it's nearly impossible to maybe do some of the things that a counselor might want you to do to improve your situation. So medication is a really important part of treatment, but it's not always required, and it's not always required long term. And counseling can also help healthy people, really help people have better relationships, people have a happier life, more successful life. So we can really help people that don't have mental illness, but really could just benefit from self-awareness. And if you think about so cognitive behavioral therapy is really looking at your thoughts, being aware of your thoughts, and actually changing your thoughts and changing your emotions. So cognitive behavioral therapy, I mentioned in the beginning, it's the most popular and the most effective form of therapy, and it's something many of you are really aware of. I think I'm always impressed at how psychologically aware many students are, and I think it's part of your generation is really learning about this stuff and really understanding about this, but really being mindful of our thoughts and really knowing that we have control over those thoughts. We don't have to be a victim of those negative thoughts. So on that note, there's a lot of promise in psychology, and if any of you are interested, I hope some of you are inspired to maybe major in psychology or at least take another psychology course. Definitely recommend abnormal psychology to learn about the psychological disorders in a little bit more depth, but there are many other psychology courses that could be fun as well. I did put a link in Module 16 um, for careers in psychology, and it's a huge long document, but it tells you what you can do with a bachelor's degree in psychology, what you can do with a master's and or a doctorate in psychology, and what kind of opportunities are out there in psychology. And there's one other link that I put in there. It's called free mental health apps, and most of them are free or have a free portion to them, but it's a Psy.com article that lists like the top 25 mental health apps